Well, good evening, everyone. My name is Vincent Bernard Orange Sr. I'm an attorney and certified public accountant here in the nation's capital, Washington, D.C. I'm also a candidate for the at-large seat on the D.C. City Council. I've had the opportunity to serve as a two-term Ward 5 council member, as a six-year member, as an at-large member representing the entire Washington, D.C., and I also served as the Democratic National Committee man for 6 years during the Obama administration. But tonight we're here to talk about we're going to be okay. During this COVID pandemic, there has been a lot of trauma, crisis, and you name it, it's taking place. Worldwide, there are 26,424,279 cases. There's been 871,866 deaths. In the United States alone, 6,329,791 cases, resulting in 190,930 deaths. We're here in the DMV, the District of Columbia, Maryland, and Virginia. In the state of Virginia, there's been 123,668 cases. In the state of Virginia, there's been 2,652 deaths. In the state of Maryland, there's been 110,012 cases, resulting in 3,778 deaths. And here in the nation's capital, there's been 14,135 cases, resulting in 610 deaths. And with all this taking place, we're really concerned about our children and the impact on them. And that's why tonight we have as our guests the authors of We're Going to Be Okay. We have with us Dr. Ebony Jade Hilton and Dr. Leigh-Ann Webb. Ladies, welcome to We're Going to Be Okay. And let's start by just having Dr. Hilton tell us a little bit about herself.
For one, thank you for having us tonight. So me, I'm just a country girl from Little Africa, South Carolina. I'm a critical care anesthesiologist here at the University of Virginia. You see my dog in the background. I apologize for that, but this is life. So yeah, I'm a critical care anesthesiologist. I'm also the founder and medical director of Good Stock Consulting, which is a healthcare firm that looks at racial health disparities. I've written a couple children's books before We're Going to Be Okay, called the Ava series, and just like to dibble and dabble in anything community related. So yeah, thank you for having us.
Well, great, Dr. Hilton, welcome. And now, Dr. Webb, tell us a little bit about yourself.
Yes, thank you so much for having us. I am one of Dr. Hilton's colleagues at the University of Virginia, where I work in the emergency department, seeing COVID patients in addition to other patients for the last few months. And I also founded the Get Well Company, which is my consulting firm. I went to business school in addition to medical school. So I do some consulting around innovation for biotech companies, so on and so forth. And I'm really happy to join in today to talk about the book we wrote, We're Going to Be Okay. And I also wanted to add in a little plug for the author, the illustrator of the book. By formal title, we kind of named her as illustrator because that's how people relate to books, but really she's a true co-creator of this book. Her name is Ashley Corinne Webb. She's my amazing sister-in-law, and she agreed to help us out with this project. She's a 2020 Ezra Jack Keats award-winning illustrator, and she just did a fabulous job bringing little Parker to life. And in a way, this message has been able to reach more and more people and families because of her beautiful illustration and how it really draws in children and families so that they can talk more about this very important topic.
Well, great. And I know that We're Going to Be Okay really emphasizes staying safe, healthy, and optimistic during the COVID-19 pandemic. And with that being said, I see that the book has been dedicated. So talk a little bit about the dedication of We're Going to Be Okay.
Yeah, I think we both just wanted to dedicate this to all children in part. I have two nieces and a nephew. My sister is a principal at an elementary school, and we kind of always pour into kids anytime we get a chance to. So this book is dedicated to those children and trying to protect their innocence knowing that right now there's a lot of struggles and changes and shifts in life that they don't understand what's going on. So yeah, we want to protect that innocence to say, let the adults help you. We're going to educate you. We're going to guide you, but we're going to get through this together. Yeah, so that's pretty much it.
Well, great. And I
Right.
see you've also dedicated to real life heroes around the world.
Yeah, and I know we're going to get into the book a little bit later, but those real life heroes, I think people at the very beginning recognized that mostly as like healthcare providers. And we wanted to make sure this was a very inclusive message. And we'll get to the beautiful illustration that Ashley did later on when we get to that page. But that page shows a scientist, a teacher, and a grocery store worker. And we're really dedicating this to like real life heroes, whether it be children who are doing their part or essential workers who are doing their part, anywhere from, someone who might be cleaning up, a janitor, a grocery store worker, anyone who is helping us get through this on the front lines. That's who the book is dedicated to, because they are real life heroes, and there's real meaning in sort of this collective action that our community is doing right now to help both sustain our economy and fight COVID-19.
Yes, Dr. Webb, that's a very good point, because generally everyone thought as first responders as the police department or the firemen or those that may be driving the ambulance. But as we go through this pandemic, we really saw that those essential workers and those first responders could be the nurses, the technicians, the janitors, everyone that's involved in this process. And it's even expanded to the grocery store clerks. They're all on the front line, and a lot of them have been exposed to the coronavirus, even the bus drivers. And it really has crystallized this issue, and also the disparities in treatment and how this COVID-19 does not discriminate. And a lot of the folks that are our first responders have been subjected to COVID-19, and a lot of them have lost their lives. Would you like to comment on that at all?
Yeah, well, it's what you bring up. What we know is that there's a group of people, and I call them targeted populations, that have shown to have not only an increased risk of infection, but also an increased risk of dying. And what we know is that those persons that are the essential workers, they've been struggling for the last decades, right, to get a livable wage they still don't have. And yet they're the ones that's put at risk. So the grocery store workers, the taxi cab drivers, the people that literally have kept this nation afloat. I feel like they are the real life heroes, because truly in the hospital, I feel protected in ways. Yes, it's very risky. Yes, we're coming face to face with people who are COVID positive, and they are the sickest of the sick. But we have our PPE, we have our protocols, we have our training of how to navigate this new pandemic. Whereas those grocery store workers and those people that are literally had to be out on day one doing their job when everyone else had to stay at home, they didn't get that training. They didn't get that PPE. They still don't have it, right? So we just wanted to let them know they are recognized for what they're doing, that we appreciate their sacrifice, and hopefully through this, we can teach their children, and hopefully they can learn something too in this book. We really did try to be inclusive in language to teach all age groups.
Yes, and it's very important to talk about the PPE, which is personal protective equipment. Clearly, there was a shortage of PPE in the initial stages. A lot of our essential workers, first responders, lacked the appropriate PPE. As well as the equipment that was needed to actually provide treatment. A lot of people winded up on the ventilators and what have you. Can you speak to that a little bit, the type of equipment that's really needed in the hospital to provide treatment?
Yeah, so as you said, we experienced a severe shortage in the United States, and really around the world. There was a severe shortage in the things that are needed to both protect providers who are taking care of these patients, as well as give them appropriate treatment in some cases. And so for all patients that we're seeing who have COVID-19 or who we suspect that we have COVID-19, we need this personal protective equipment, or PPE. And for us in the hospital, that includes a mask. In some cases, we wear just a regular surgical mask, but what really protects us against COVID-19 is one that has a suction seal around it. It's called an N95, and then there's some higher level of protection as well, like a P100 mask. But we need that mask. We need that seal to be tight so that air cannot flow in and out, so that small particles cannot flow in and out. Hopefully we can still breathe with the mask on. And then we also need eye protection. And then most of us wear hair protection as well. And then, gowns and gloves and the basic things we need to protect ourselves against infectious diseases. And very early on, and face shields as well. We use face shields. And very early on in the pandemic, we recognized that there was a shortage. Our community, gratefully, we're very grateful that it was not hit as hard as some other communities. So we watched what was going on in California and Washington and then New York. And there was some anticipatory anxiety, provider-related anxiety related to that and the shortages and this feeling like, okay, it's going to hit our community. And when it does hit, do we have all of the supplies necessary? I am very happy to say that the University of Virginia, which is where Dr. Hilton and I work, they really worked hard, both innovating in terms of testing and getting rapid testing at University of Virginia for COVID-19, and also getting providers the things that they needed. And it was really a community effort. Literally, people were in the community innovating around how do we get face shields, how do we get goggles, how do we get these orders of masks placed, can we get some cloth masks, temporary cloth masks that we can use to cover the personal protective equipment that we do have. So it was really like a group effort or a community effort. And then in terms of treating patients, COVID-19 can cause a spectrum of illness, but it also can be that the patient is completely asymptomatic, meaning they have no symptoms at all. And so people who don't have any symptoms at all should mostly be at home or not in the hospital setting. Unless they're going somewhere to be tested, have asymptomatic testing. And then you have sort of cough, cold symptoms. It can cause headache, loss of taste and smell. It can cause shortness of breath and coughing and those typical respiratory symptoms that you hear about. And then other things too, like abdominal pain and diarrhea and body aches. And so really it can present in a number of ways, but the patients that we get really, really concerned about are the ones that are super, super sick. So difficulty breathing, their oxygen is low. Sometimes in some cases their organs are failing as well. And those patients need very specialized equipment like ventilators, where we place a breathing tube in patients and we hook them up to a machine. And so very early on, we saw a severe shortage in the machines, and we saw providers and hospitals having to make really tough decisions, like who are we going to put on a machine? And we saw innovations that we really hadn't seen before, like putting 2 people on one breathing machine. And so thankfully we are over that hump in a sense, that the supply chain has improved. There are still some problems with personal protective equipment, but for the most part, hospitals and providers are getting what they need to safely take care of patients. That being said, none of these things are 100%, even for providers with full personal protective equipment on. You're never 100% safe, but we feel a lot safer in that risky environment when we have the things that we need.
And I also know, Dr. Hilton, that this was very tough on families, especially when one is admitted to the hospital, then the families cannot come in and visit them. And then with so many deaths in the United States, 190,930, a lot of folks were unable to really give their goodbyes to their loved ones. And I'm sure it was difficult on the family, but also you being in the field as physicians, it had to be difficult on physicians as well. In a lot of cases, you're the last one to see the patient.
Yeah. I mean, it really is difficult. And I think, honestly, I personally have not processed 2020. I know I haven't. It's been one of these things of keeping busy and doing a lot of community engagements and working to keep my mind distracted, to be completely honest with you, because there is such a thing of being afraid of the unknown. And particularly in this instance, yes, I'm a physician, but I'm a Black woman first. And what we know is that racial health disparities with COVID-19 exist. And literally from the first death in February 29th was when we had our first death in the United States. I immediately had this feeling of it's going to hit us. And by us, I mean Black people hard. And so got on Twitter and started saying, CDC and World Health Organization, we need you to actually release data to tell us who you're testing. Are you testing Black and brown people? What are the numbers? What are the rates? And it took literally over a month before we had any response. And even that response that the CDC released was very brief, of only 14 states that they interviewed or supplied their data about. And so I haven't processed the loss at this point. And even with this book, we say we're going to be okay, knowing that there are going to be a large percentage of people who are not okay, including children, right? We know that children have been infected by this virus. We know that children have lost parents, they've lost siblings, they've lost grandparents and aunts and uncles, classmates. And so we wanted to be respectful of that in this book as well. And you'll see when we read through it of how we literally left a page in the book that says, how are you feeling? And it has the child draw out their face. Is it a happy face? Is it a sad face? So that we can present that area of vulnerability to let them know it's okay to not be okay today. It's okay to feel angry that you missed a birthday party. It's okay to feel sad because someone may have passed away. That there's a whole range of emotions that are completely normal, that we have to process through as a nation. I oftentimes say, we're trying to get to 2021, but honestly, we don't know the end date of this. So working through those emotions sooner rather than later is probably the best thing. But I don't know if I'm the best example of that process. Not yet, but right. I'm trying to get there.
Right.
Mm-hmm.
Right. And I know initially there was a lot of misinformation. It was thought that COVID-19 was really for the elderly and for the older folks. And it was, this communication that this would not affect children. And so that, in having that in our communities, our children were running free. Hey, the children, they can't get it. They can't pass it on. And then all of a sudden, we find out that COVID has now and is affecting our children. Can you talk about that discovery when it was determined that children could be infected by COVID-19?
I think the media and the headlines have a lot to do with sort of a lot perpetuating this misinformation, right? And especially social media. But we knew early on that children, when we look at children and respiratory viruses, not only do they get it more often, they're in close proximity to each other at school, it's spread, right? There's always a cold in the household when the kids are in school or in daycare. So it didn't make sense from a medical standpoint to say that children weren't getting COVID-19, but you're right, that information was out there. I think for the most part, children were somewhat protected because schools were shut down rather quickly, right? And so you still had adults and essential workers going to work and going out into the community, hopefully social distancing, but some of that didn't happen as well for some households. But children were largely protected from being out and about sort of in public in ways that would make them more vulnerable. What we've seen over time is that indeed children can get COVID-19. Gratefully and thankfully, children are not affected as much as adults are. We'll see what happens, as schools are reopening, as colleges are opening up as well. But children are not really affected in the same way as adults, so they can still get COVID-19. It can also it can also make children very, very sick. But what we're seeing is mostly very mild symptoms in children with COVID-19. And that's certainly what I'm seeing in the emergency department, taking care of children. We know, though, that same disproportionate effect that Dr. Hilton mentioned with adults and Black and brown communities being affected more so by COVID-19, the same is actually true for children, and especially the sicker children. So 70% of the children who are hospitalized for COVID-19 actually do pretty well. They have a couple days stay, I think 2 to 3 days on average, and they go home and they actually do pretty well. But 1 in 3 of those actually requires ICU level care. And then there's a particular illness that can be seen in children as well called multisystem inflammatory syndrome in children, or MISC. that we're seeing children become very, very sick from that. And that also disproportionately affects Black and Hispanic children, unfortunately. And it's said that some of that is just the exposure in their community in general, right? The grownups that they're around, but also in children who are obese, and children who have chronic lung disease. And for those children who are tiny, like less than 2 years old, if they had prematurity or less than 37 weeks old, they're affected. All those things actually affect the Black community more than other communities as well. So we are seeing it. Thankfully, children don't get as sick, but there is a possibility that they do get critically ill from COVID-19.
Yes.
And with that being said,
good.
Sorry, I was going to say, with that being said, so there's been new studies and new reports coming out. I'm not sure if you saw the athletic director for University of, I want to say it was Penn, said that 30 to 35% of his athletes that had tested positive for COVID were showing signs of what we call myocarditis, meaning that there was inflammation of the heart. There was another study out of Germany where 6 out of every 10 patients that had COVID-19, they had mild diseases, they had even asymptomatic presentation, and yet 6 out of 10 of those had signs and symptoms of myocardial inflammation. So with these children, one thing we have to know is that how often are we getting echoes? How often are we getting MRIs? Or any other investigative work on the heart? We don't know enough about this disease process. The reason why I'm saying this is that oftentimes people say, "Oh, well, the kids, they're not dying from this." We're seeing that the case level for kids, they are increasing. They're increasing actually faster than adults now because the kids are going out into society a little bit more than what we're seeing. So the rate of them getting infected is increasing. And we don't know the long-term effects of what COVID-19 does to the body. So we need to be very cautious with our children. We need to take great care that we are not putting them at increased risk. They may not die at higher rates, which is fantastic. But what we do know is that if your child did not have COVID-19 versus the fact that they did have COVID-19, their risk of dying is increased by 17 times, right? Just because your child has the virus, because normally kids don't die, right? We do a pretty good job treating their diseases. So this one virus alone, just having it, then the chances of your child dying is just higher. So we want to make sure that we keep our babies safe.
Yes. And so talking about our babies, school started this week. And that's why, this book is so real. Parker and his mom and his dad, and Parker's looking forward to going to school. And so I'm going to go ahead and start out with Parker. So here we go. Beep, 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 rang the alarm clock. The smell of blueberry pancakes filled the house. Parker leaped out of bed. Today is show and share Monday, he said. All weekend, he worked with his dad to make an erupting volcano experiment that he could not wait to show his class. Beep, beep, beep.
So Parker rushed into the bathroom. He brushed his teeth, he combed his hair, and he put on his favorite blue striped shirt.
He ran downstairs excitedly, but found his mom and dad still in their pajamas. What's going on?
Buddy, I've got some news, his dad said. School is going to be closed for a while. There's a new virus causing people to get sick. It's called coronavirus. What's coronavirus? Said Parker. And Mom says, let me get my lab coat. Dr. Mom has answers for you.
Yes. So there are other forms of coronavirus that have been around for a long time. They usually cause a cold, but this new version is super sneaky and has caused many people across the world to become sick, said Mom. The other names for this virus, Dad points out, is SARS-CoV-2. That's the scientific name. Coronavirus, what your friends and your media may often call it, right? And then COVID-19, that's how doctors describe the sickness. So CO stands for corona, VI stands for virus, D for disease, and 19 for 2019.
Coronavirus germs live in people and on the things we touch with our hands, but there are simple things that we can do to keep us safe. Mom is telling Parker. Simple things like what? Parker asks. I'm scared. Here are some ways that we can stay safe. Stay safe.
All right. So when we look at this page, stay safe, there are 6 things to do to stay safe. Wash your hands with the soap and water for 20 seconds to remove all germs. Now, what's the significance of 20 seconds?
So
that's how long
go ahead.
Go ahead.
Oh, literally, that's how long we suggest that you actually wash your hands. And when we're saying to wash your hands, oftentimes people just, lather here, but we really want you to lather all around your thumbs, right? To do what we call a surgical scrub. So to make sure that all areas of your hand are actually in contact with the soap and with the water at the same time. So you can sing different songs. It can be helpful if your kid likes to sing Twinkle, Twinkle, Little Star or Happy Birthday. But that length of time will allow to make sure that you truly have effective contact with the soap and any bacteria or any viral shedding that may be on your hands.
Now, the emphasis is on washing your hands. Now, after you wash your hands, should you be washing your face?
Well, you shouldn't be touching your face, that's for sure. Okay. So as long as you have nice, clean hands, of course, you should wash your face however much you normally wash your face, but just making sure you have very nice clean hands. And then there's another part in here that we'll get to, but it's don't touch your eyes or your nose or your mouth, because we know that one way that the virus can spread is on dirty hands, but we get those dirty hands from touching things, right? And then touching our face afterwards. So you want to make sure your hands are clean and you want to make sure you are not touching your face.
Okay.
Even in the shower. I was gonna say, even in the shower, when I'm in the shower, I first wash my hands fully. Because oftentimes, I don't know, you see commercials and people go in the shower and the first thing they do is wash their face. And so you're touching your face before you had a chance to get rid of the virus that may be on your hand. So the first thing is to wash your hands fully, and then you can touch your face and the rest of your body. But you want to make sure that these are clean before you touch anywhere near your eyes, your nose, or your mouth. All these areas, eyes, nose, and mouth, they literally all connect in your body, oddly enough, if you look at a skeleton, right? So that's why we say you can get transmission of COVID-19 in the eye. So cover yourself.
So the key is wash those hands really good, though, right? A minimum of 20 seconds.
One part. That's one part. Yes.
One part. That's one part.
Yes.
Okay. Yes. And now moving on, it says cover your nose and mouth with a washable face mask or scarf. Would you like to elaborate on that?
Yeah, so we talked a little bit about contaminated surfaces, right? So you want to make sure your hands are clean and not to touch your mouth or your nose or your eyes. But the other thing you want to do is make sure you keep your nose and your mouth fully covered. Now, we've been seeing a lot of people with a mask around their ear or under their chin, or I don't know, in other weird ways wearing a mask. But making sure when you're out in public and when you're around other people, it's important to make sure your nose is fully covered, as well as your mouth. And the reason is because when you're around other people, not only can you sort of get the virus from contaminated surfaces, but you can breathe in the virus. And the virus can also, little particles can get in your eyes as well. And so when other people are talking, even if they're talking normally, there's a little bit of virus particles, if they're infected, that spew out into the air. And we know that some of these can hang around for quite some time if they're really teeny tiny, but we expect the mask to catch most of the particles. It won't catch all of them, but it will catch most of them. And then if both people have on a mask, we know that less particles get into the air when they're interacting with each other.
Okay, great. And then another stay safe measure is stand at least 6 feet away from other people when you're out in public. So although you have your mask, do you still want to stand at least 6 feet away from other people?
If not more. So I oftentimes say that, so the 6 feet away, right? to be completely frank and honest, it's not like we've done randomized studies to say is 6 feet away far enough away for this to be the safest distance, right? What I always say is that if I can reach out and touch you, you're definitely too close. But I don't need you to be in my personal bubble or me in your personal bubble at any point during a conversation, regardless if we're outside or indoors in the house. So we said 6 feet because the thought is the large droplets that when we see commercials, for instance, of in cold and flu seasons, and when people are coughing, and the Mucinex commercial shows these droplets spraying out, those large droplets tend to drop and hit the ground within a 6 feet distance. So that's why we said 6 feet away at least. But the truth of the matter is, as far away as you can possibly stay from someone, the better, right? We know that our masks, you see these memes and they say, oh, masks don't work. Masks work to the extent that they can work, right? And staying 6 feet away works to the extent that it can work. The best option for you is to just avoid being in close range of anyone at any time, to stay away from crowded spaces at all times, and to try to stay, in the safety of your home as much as possible. But if you do have to go out, and if you do have to venture into the world that we know many people have to do for work, staying 6 feet away, wearing your mask, and washing your hands are the three things that we say kind of up front.
Okay. And then we also said when you're coming home, another stay safe measure is to leave your shoes at the door. Now, does the shoe carry the virus? How long does the virus live?
Yeah, so Dr. Hilton did mention that, when you talk, some of those large droplets fall down to the ground. And when they've done research in hospitals, it's shown that COVID-19, if the surface hasn't been cleaned, COVID-19 is everywhere. COVID-19 is on the walls, it's on the hospital gurney, it's on the floor, it's being tracked everywhere. Now, thank goodness we're really diligent about cleaning the hospital after each patient's room. But if we translate that into what may be going on in public, that's why we give this little bonus tip, especially for kids, to leave the shoes at the door. You do not want to track anything into your home, right? You want to keep your home nice and clean, especially with young children who may be crawling on the floor. Their toys might be out and about. Then it's much harder to control than putting their hands in their mouth, especially if they're toddlers. So the safest thing, as a bonus tip from Dr. Hilton and I, is just to leave those shoes at the door.
Okay. And now we know that there's been a lot of purchase of goods on the internet and Amazon all over the place and delivering these packages, and UPS and FedEx. It seems like business is booming. What about these packages that are delivered to your home?
Right. And, we encourage you to do the same thing that we say as far as your hands. When you get packages from the delivery guy, just to wipe those items down. So you asked how long can coronavirus live, right? So what we know is there are studies that showed that coronavirus can live on plastic and stainless steel for upwards of 72 hours. So for 3 days, right? On cardboard boxes that has that porous material, we tend to see it last for hours, like 3 maybe to 10 hours. And so what I typically do for me in my home, when I bring in the box, I wipe the box down. I wipe all the items down that's inside of the box before I put it into any cabinet space. And again, as soon as I touch anything, it's washing my hands over and over again. And it may make you feel neurotic, but trust me, if it's the difference between not having COVID-19 and having COVID-19, then washing your hands frequently is going to be your best bet. And you don't have to necessarily always use bleach. You can use just soap and water. Soap and water does a great job at actually handling the COVID-19. But yeah, keeping those surfaces
and the
clean.
same with groceries too. I know you mentioned specifically boxes, but a lot of the things that we get groceries in, the packaging is plastic, right? And so, especially early on in the pandemic where we did not see people wearing masks out in public, I was like frantically scrubbing down everything with bleach that came into my home before I put it away into the cabinet. I am still doing that, although I think the risk is probably pretty small. It just is a very small thing for me to do to make myself feel better, because so many of those things are covered in plastic and cardboard, quite honestly, almost all of our packaging now.
Okay. And then I see the other two things that we have here is don't touch your hair or your face, even with gloves. And we talked about that. But can you talk about the gloves? Should one also wear these gloves when they're out in the public domain?
Yeah, so a
Right.
lot of people are going to wear gloves. They don't have to, right? So the basic tenets of having hand sanitizer and washing your hands very frequently whenever you touch anything, those are going to hold true regardless of whether or not you have gloves on. What we see with people out in public, or what we call like lay people, people who aren't trained as health providers with gloves on, is that there's almost a false sense of protection with gloves on. So we might see people at the grocery store with gloves on, but then they're touching everything, and they might be touching their face or touching their hair or reaching into their purse to get their keys. And so they feel like they're protected with these gloves on, when in fact they are protecting their skin, but they're touching everything, and then could potentially what we call cross-contaminate themselves or touch themselves and make themselves or others sick with these contaminated surfaces. There is a special way to take off gloves so that you don't get the outside of the gloves on the inside of your hands when you take it off. So gloves can pose some challenges if you're not really thinking through what you're doing when you have them on. So the safest thing really, and what should take care of most people, would be hand sanitizer and washing your hands for 20 seconds.
Yes.
Yeah, and
finally,
treating your gloves as if they are your hands. So basically, if you're
Okay.
wearing gloves, act like that's your skin. And so you can only do the same things that you would do as if it were your skin, which means that if you have gloves and you just feel like I need to wear these for safety of mine, then the same thing, you can't touch your face. The same thing, you have to wash your gloves with hand sanitizer or with soap and water. You would do the same thing. So for instance, if you're going to the grocery store and you say, I want to go grocery shopping with these gloves on, then go ahead, go grocery shopping with the gloves on. But when you get to your car, you have to take these gloves off before you start touching your steering wheel, for instance, unless you plan on decontaminating your steering wheel. Or if you have these gloves on and you touch something muddy, think about if you just put your hand in a mud puddle, right? Consider, what would you do if you knew your glove was that dirty? Would you put that glove into your purse to reach for money to pay for your groceries? No. Would you take those gloves and rub it through your hair? No, right? So every time you have on gloves, again, because it usually gives a sense of security, just think, if I had a lot of mess on these gloves, what would I do? And you would take them off, or you would wash your hands before proceeding. So, yeah.
Okay. Good. And then finally, we want to tell Parker and all the kids, keep your home clean.
Always, even when COVID-19 goes away, which hopefully will be soon. Yes, keep your home clean. Help your grown-up keep the home clean, sparkling.
All right. And Dr. Webb, you know from firsthand experience, would you indicate you have a 9-year-old and a 5-year-old?
That's right.
Great.
Absolutely. They've been
All
getting a lot of cleaning lessons around the house during this pandemic.
Okay, great. And Dr. Hilton, with your 2 dogs, how do they help with keeping the home
Listen,
clean?
they don't. And somebody needs to start paying rent around here. Right. But speaking
All
of,
right.
what people with pets, though, speaking of washing their little paws. So again, people, they do a lot of things outside on the sidewalks, including spit, right? And if they're spitting on that sidewalk and your dog, who doesn't know any different, runs through that and then runs throughout your home, or they're putting their paws in your face, well, guess what? You just got whatever's on the bottom of their feet. So making sure that you're wiping their paws down before they come into the house is also important.
Now, speaking of animals, do animals get COVID-19? Can animals pass COVID-19?
I heard of like 1 or 2 animals being tested for COVID-19. Now, any transmission from animals to humans, I have not heard of.
Okay.
So yeah, I think it's mainly us doing it to each other, which we are animals. So yeah, there you go.
Okay. All right.
Yeah.
So let's move on to stay healthy, and I'll turn that page over to Dr. Hilton. Let's talk about staying healthy.
Yeah. So staying healthy. The first is eat healthy snacks. The second is exercise every day, like run, skip, jump rope, bounce, or ride your bike. You can get plenty of rest every night. So we know 7 to 8 hours of sleep is a good thing for you to do. Take walks outside with an adult. And then practice positive self-talk. When you're feeling down, talk to someone you love. You can also journal or express yourself through art. Try to think about things that make you happy. Saying things like, it's not my fault and it's okay if I have things to change for a while. And stay connected. We know this is a time of isolation. So video chat with your family, friends, and teachers, and just encourage socialization, although we're being physically distant. Right?
Okay. And so, well, wow, we went through that one very quickly.
Oh yeah.
So let's, yeah.
Right. Good.
All right, but bottom line, hey, stay healthy, folks. And now, Dr. Webb, you want to take us through helping others?
Yes, so this is one of my favorite pages because I think so. We produced this book very early on in the pandemic, and a lot of people just had a lot of angst and anxiety about being in the middle of the pandemic, but they also wondered what they could do to help. And so I really like this page for kids. So the first thing is save extra water and food each week in case your neighbors get sick and may need your help. If a neighbor does become sick, cook them food to help them out until they feel better, and that will have to be a contactless delivery. Send a card or email and call your friends and family to check on them. Find unique ways to celebrate friends on their birthdays. And having 2 young kids, I know that kids are being very innovative about the way they celebrate birthdays in the pandemic over the last few months. And then finally, find creative ways to use your time and talents to help brighten someone's day. And kids are so creative. And so that one comes pretty natural for most of them.
Yes. Okay. All right. So I think it's back to me. So doctors, scientists, politicians, teachers, and many other essential workers are working like superheroes to keep us healthy, safe, and secure. Would you like to add anything to this discussion about our superheroes? In fact, you two are superheroes.
Yeah, I think it speaks for itself that again it's these essential workers that I really think deserve all the praise. They were on the front line from day one when we didn't know how to combat this virus, that we didn't know how it was really spread from person to person. They weren't given the PPE and the training and had the experience of how to protect themselves, and yet they showed up every day so everyone in America could still have food on their tables, and the things they needed for their families. So, and now we're truly seeing my sister is a principal at an elementary school, and we're seeing how teachers are stepping up to meet this challenge too. So, yeah, we're just grateful for everyone and how they play their part.
Yeah, and you know, I really love this page because everyone has the little cape. You see the little cape back there?
Mm-hmm.
It's kind of subtle,
Yeah.
but it's cape.
Ashley did a phenomenal job illustrating this and all the other pages. I remember when she was, sort of sending us, we sent her sort of the copy, and then she was going back and forth with the illustrations and also contributing to the copy. And like a couple of the pages, including this one, I saw and I like gasped because the capes were there first, and then she sent another version that had like the capes, and I was just like, oh man, I just like love it so much. It was so fun to work on this project with her.
Yeah, and the capes can also be angel wings as well.
Yeah. Yeah, sir.
All right, Dr. Hilton, the next page is yours.
Yeah. And our family, neighbors, friends, and the whole country will stay in our homes to stop the virus from spreading until it's safe again. And this one I thought Ashley did a fantastic job in just showing how, this is looking like a neighborhood, but you can see it's across the globe. to just let kids know that you may feel like you're the only one that's going through this, but we're going through this as a global community. And that, yeah, that you're not alone, that, and the little hearts coming out of the chimney should just show that you are loved and appreciated. So it's beautiful.
Right. Well, I'm glad you pointed out the globe. I had missed the globe, and now I can see it. Yeah,
Yeah.
that's very nice. Very creative.
Yeah.
All right. And Dr. Webb, we're back to you.
And if you do your part, you can be a hero too. And we love this page because Parker's doing his part. He's washing his hands for 20 seconds, of course. He is waving from a distance to an elderly person. Maybe it's a neighbor, maybe it's a grandmother. They're celebrating a birthday with some balloons and just enjoying each other from a distance. And then in the third panel, Parker is using his time to draw a picture and write some letters to people. So one says, "Dear Dr. Smith, you're doing a great job. Love, Parker." And the next one says, "Mrs. B, I miss you. I hope you're safe. Love, Parker."
Very good. So we have Mom washing her hands. He has her soap. We have Parker waving to folks, and he has balloons, and then the letters, just communicating with others. And let's see, then it's now on me. So it's more or less, this is the page, basically, together we stand, divided we fall. And it says here, I know that no matter what happens, we're in this together. We're going to be okay. And then the mom has the tablet where she says, wow, cool, good job, Parker. And Parker is all smiles, and his project that he started out with, the erupting volcano, there it is. And, it's really nice, and the characters are great, and I think this is a great read with children. And the good thing about this is one can go online, you can download. We're going to be okay, and it comes in English and Spanish, and that is so wonderful. And so now we're going to go on to the next page, and Dr. Hilton, we're back to you.
Right. And so this page I particularly love. It says, "Today I feel," and it says, "Show how you're feeling. Draw a face showing how you feel today and write about it." And the reason why, if you look at the bottom of the page, it has a frowny face, and then it ranges all the way to a smiley face. And we titled this book, "We're Going to Be Okay." But as I stated, my little sister is a principal at an elementary school. And unfortunately, she had very early on, some of her first and second grade students had family members who passed away from COVID-19. And I couldn't shake this feeling of, how do I talk to them and allow them to have this area of expressing how they feel, to express if they weren't feeling okay, and to allow parents to have this entry into a conversation that you may not know how to do. Sometimes I think we're afraid to tell a kid that they're sad. And so if you give them a page and say, just draw how you feel, and this is your journal, you can write whatever you want to, so the child can have this outlet, and then that can be the start of the conversation of, how do I walk through this with you? We know that it has uprooted them in all ways socially. They've missed birthday parties, they're missing classmates, and what this will do to their overall emotional health is still yet to be seen. But we wanted to do our part to tell them that it's okay to feel that way, and to make sure they had a space to vocalize that.
Great. And Dr. Webb?
Yes. The next page is create an I get to list. And so Parker says on his I get to list, he gets to wear his Halloween costume all day long because he's inside staying safe. And I can attest that that is a very fun thing for young children to do while they're staying at home. My kids have done that a couple times, and it's a great way to reuse a Halloween costume as well and save on laundry.
Great. Well, that is so great. And the on the back cover, it provides free resources. The White House, CDC, and FEMA. We have their website. We have the Centers for Disease Control. and their website, the World Health Organization and their website. And then you also have Psychology Tools, the Wellness Society, Good Stock Consulting, and the Get Well Company. And also once again, we have a little bit about you all. We have a little bit about Ashley Curran Webb, who is the illustrator. A little here about Dr. Leigh-Ann Webb and Dr. Ebony Jade Hilton. So this has been wonderful. And once again, if one would like to get, we're going to be okay. These are doctor tips inside. It's really a great discussion on staying safe, healthy, and optimistic during the COVID-19 pandemic. So one can go online. Dr. Webb and Dr. Hilton, can you tell them where they can go online to download the book?
Yeah, so they can go to either of our websites, which are the two last websites listed on the back page. So you have the Get Well Company, which is Dr. Leigh-Ann Webb's page, and then Good Stock Consulting, which is my consulting firm. So you can go to either of those web pages under our resources tab, and the PDF for both of these files in both English and in Spanish is there, completely free for individuals to print out. We also have on those under those resource tabs other available informative packages for not only adults but for kids too. And we say for any social service, organization, if you are delivering meals or if you are doing a mask campaign and you're handing out masks, or if you're a teacher and you want your students to have this, go and print it out. It's completely free for you to use. Only thing we ask for any organization that's using any of the materials that we provide for free is that we want them to remain just that. We never want to charge associated with anything we're giving out. We want every child to have access to this. We want every adult to have access to this. So, yeah, but otherwise, we made it available for all.
Okay. And you also indicate hard copies
I
as
was
well?
just going to say it's available in hard
Yeah.
copies as well. You have a hard copy, I believe, there with you.
Yeah, I have a copy. Yes. Very
Yeah,
good.
but one of the things that we're really proud about is really the community engagement surrounding this. And again, I think part of it is like just the art that goes with the messaging, right? And so it started off with an anonymous donor here in Charlottesville donating $25,000 to have 10,000 copies printed. And then they also arranged a distribution network for us through organizations like the Boys and Girls Club. And now over 16,500 hard copies of the book have been printed out in English and Spanish. The Arabic translation is pending. And someone also made an American Sign Language storytelling activity related to this. Teachers are really gravitating to it. And so it's been amazing to see how the community has sort of taken this and sort of made it their own.
Well, this is great. And you also indicated that you've written other children's books.
Yeah, so I have a couple children's books called the Ava series. So Ava's Big Move and then Ava's First Day of School. So I have two nieces. One is 16 and one is 4. And I didn't know what I was doing with the 16-year-old. I didn't know how to be that cool auntie, but I finally got it with the 4-year-old. And but she loves to read, and I wanted her to have a book where she could see a visualization and a representation of someone that looks like her as the main character. And that's one of the big things with this book. I oftentimes say I don't write Black children's book. I write children's books. And I make that point because I want Black children to start being looked at as just that. They are just kids. And oftentimes they're not viewed as children. And so I want, white families and Black families and Hispanic families to start seeing a Black child as the lead character and allowing them to express this story. So the Ava series is on Amazon if you like to get it. But yeah, it's kind of cool.
Okay. All right. So do you guys have any joint projects in the works?
I really want to, and I know Leah's going to kick me. we do a lot of community engagement. But quite honestly, like I said, this book is titled "We're Going to Be Okay." But what we know is that 190,000 Americans right now are not okay. Their families are not okay. They're at a loss of what has happened. And we know that we're still very much in the early stages of this pandemic, and that number unfortunately will continue to stretch. So I would love for us to write another book that's, it won't be titled "We're Not Going to Be Okay." I'm not that morbid, but a book that literally does talk to the grief and how do we process that, particularly for children who don't have the emotional maturity to give it a word. And we know that PTSD takes shape in all different ways. If they unfortunately had to see a family member having difficulties with this virus, how do we cope with that and working through those layers that develop of missing out on milestones of life, of celebration? How do we make sure that we don't gloss over that as we head into 2021, but that we literally try to go in and say, let's pour out that hurt so we can begin to truly heal and it not carry on for the different stages of your life. So if we can get Ashley, who, by the way, so when we found out about this this book, literally someone on Twitter wrote me about this children's book competition that Emory was having, because they knew I wrote children's books before and I was talking about COVID-19. So they said, oh, it'd be great. So I went to Lee and to Ashley, who we had already worked on projects together, and said, hey, there's this contest. We have 10 days to enter into it. Do you think we can do it? And Ashley has a brand new little baby. And so I don't know how she was able to handle motherhood and creating this beautiful art piece within 10 days, but she did it. So she may not want to she may not want to answer an email from me asking about another project. Yeah. But once she catches wind, I think that'll be a great next one to do.
Okay. Well, this has certainly been a great opportunity for the listeners to really learn more about COVID-19 and how to interact with your children. Definitely timely, since school is starting this week, and the majority of the United States is engaged in distance learning. And hopefully we'll be able to return to the classroom soon. However, I think people need to prepare for the second wave. I know here in the nation's capital, in the District of Columbia, our mayor is hoping to get back into the classroom on November 6th, but it doesn't look like that's going to come to fruition. So the big challenges right now is ensuring that all our children have tablets or laptops, and they have access to the internet, as well as training so they can engage in distance learning. The fact that the pandemic hit in February and people started really taking it serious in March, the schools were shut down in March, and we just want to make sure that at least learning can continue. And so that's the challenge that we have here before us. We also need to make sure that everyone registers and get out to vote on November 3rd, 2020. That will have a major impact on how we address COVID-19 in the future. Obviously, there's been the different theories on how this should be addressed, but I think the basic theory is what we've discussed today. Wash your hands, put on the mask, maintain 6 feet at least, at a minimum, and keep your hands out of your face. And at the end of the day, we're all in this together. Let's work together. So I think that this has been fantastic. The disparities in our communities. This has hit the Black and brown population extremely hard. It has hit our essential workers extremely hard. And so it's a very rude awakening, but COVID-19 does not discriminate. And so, Dr. Hilton, Dr. Webb, anything else you'd like to add to this discussion, which has been wonderful?
No, the only thing I can say is vote for you, because clearly you're engaged in
I
community.
appreciate
And
that.
it honestly is important. What we've seen in this whole thing is that politics can play a huge part of your health and your wealth. And right now, Black people, Black and brown people, we're losing jobs. Black and brown people were getting evicted. Black and brown people were dying at higher rates from COVID-19. And we need to vote in people who actually see us as people and want to do things with the lens of equity, and doing things like this, showing that you actually care about community and want to reach out to the most vulnerable, which I think are children who have little voice in anything that we do, I think speaks volumes. And so for me, you can actually vote early in Virginia starting September 18th. You can vote in person if you go up to the precinct. And that's where I will be, bright and early on September 18th and casting my vote. And that way, and if not, you can do your mail-in ballot. But certainly, we know that there's a lot of shenanigans going on right now, and voting will not be something that I miss.
Yeah, and you're absolutely right about the shenanigans, because I could not believe that our president is telling folks to, well, get the ballot in the mail and send that in and vote, and then on election day go and vote. So, I mean, it's going to be a big mess. But at the end of the day, we must do our part. We must go and vote. And also, there just needs to be a real discussion on the new normal, the new order. You know, some folks don't want to have their temperature taken, but when you go to a sporting event, you don't cry about them wanting you down to see whether or not you have a gun, knife, or some other weapon. And taking your temperature is a lot easier. Just put it to your forehead and you're good to go. And so, you know, we have to get ready for the new normal. You know, here in the district, our new normal is, if you're going to go out to eat at a restaurant, there can be no more than 6 people at a table. Must maintain the 6 feet distance, and we all just need to be very, very careful and considerate of others, especially our elderly population. A lot of us with pre-existing conditions that really just do not need to be exposed to COVID-19. And to the young people, especially when you go out and hang out and have all these, you don't have face coverings and whatnot, and then you come home, you know, you're coming home to your elderly relatives, to your elderly mother, your elderly brother, sister, father, aunt, uncle, grandparent, and you want them to be around. You want them to be around. So let's be careful. As the book says, we're going to be okay, but we're going to be okay once we understand that we are all in this together, and together we stand, divided we fall. So, Dr. Ebony Jade Hilton and Dr. Leigh-Ann Webb, as well as Ashley Cornwebb, please, send our regards to her and tell her thank you so much for these wonderful illustrations. And our hats are off to Parker, Mom, and Dad. And this has all come together. So thank you all so very much. And we look forward to your next joint project. And as time goes on, I hope they will be able to have you back to give us an update on what's going on with COVID-19, because they are saying that, you know, the second wave is coming. And perhaps also we could talk about the vaccine. There's some folks that saying the vaccine may be on the way, but you know who gets the vaccine first? And a lot of folks are saying they don't want to take the vaccine. Let everybody else be the test tubes, and they take it first, and let's see how the vaccine works. So there's a lot more for us to discuss, and I'm just so happy to make your acquaintance. I want to give a shout out to Studio 202, and I really want to give a big shout out to Vincent Orange Jr., who actually brought this idea to me. I know he works with y'all down in Charlotte, and you guys appear to be doing a great job, and you're just making us proud. Men and women of color being out front and embracing everyone. At the end of the day, it's all about, and I'm an alpha, so it's all about manly deeds, scholarship, and love for all mankind. And you certainly have exhibited that here tonight. And yeah, AKA?
Yes, 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 sir. You know it.
All right, all right, all right.
Thank you
And
so
so
much for having us. Appreciate it.
Yeah.
thank you. And we're looking forward to putting a AKA in the White House, or at least at the vice
Exactly.
president's
There will be so much pink and
residence.
green in the
Mhm.
White House. If this happens, there will
Right.
be so much pink and green flooding
Yeah.
DC.
Right.
All right. Well, hey, we can't wait because those colors are bright, and just like your book, we're going to be okay. We're looking for
Yes.
the pink and green, and
Right.
and also know that your alpha brothers, black and gold, will be there to open the doors to the nation's
Okay.
capital. So, thank you all so much. Have a great evening,
Thank you.
everyone. Thank you.
Thank
Bye.
you.
Thank you. Thank you. Once again, thank you, Studio 202, and thank you, Vincent Bernard Orange Jr., for bringing this great idea to Vincent Orange 2020. Vote on November 3rd, 2020. Thank you.